Ethnography by Katarina Youngblood. I chose to do language barriers in medical clinics in Anchorage, Alaska. So, ethnography is the study and systematic recording of human cultures. It is a scientific description of the customs of individual peoples and cultures and provides an account of particular community, society, or culture. It also requires fieldwork to collect the data. So typically the anthropologists that study this are cultural anthropologists. Cultural anthropology is the study of human society and culture, the subfield that describes, analyzes, interprets, and explains social and cultural similarities and differences. So first I just wanted to introduce myself. I'm Katarina, and I chose the topic of language barriers in medical clinics in Anchorage, Alaska. Just wanted to let you guys know that I will not be using any names of the clinics that I went to, any of the doctors or nurses or medical assistants that I spoke to, and I will not be using any patient names, obviously, because that's a HIPAA violation. So what I wanted to know about the different languages that come through the medical offices is what type of languages that came through the offices, German, Spanish, is it any native languages, especially being in Alaska, I feel like that would be a big one that they would come by. I want to know how they go about dealing with the patients, if they have an interpreter on site, if their staff is only bilingual in different languages, if the patient brings an interpreter with them, and if and when they come across the language barriers, what do they do about it? I mean, if you can't speak to someone, it's hard to give them proper care, so I would like to know how they go about dealing with that type of situation. So clinic number 1, all I found out is that the front desk lady speaks English. That's about as far as I got. No one wanted to help me. Clinic number 2, I asked if I could speak to one of the nurses or the doctors, and they told me to sit in the lobby and wait, and that someone would come out and talk to me. And an hour later, I was told that the doctor went home and the medical assistant was no longer there. Denied. So clinic number 3, I actually did get to speak to the doctor and the medical assistant. The doctor was probably mid-40s, and I feel like he was more willing to help somebody. He told me a couple stories about patients that didn't speak very good English, and how they went about it. So the first story, they have a Spanish-speaking patient. They do have a medical assistant in their office that speaks Spanish that's available for his appointments. The patient also has an interpreter that comes with him to his appointments because he doesn't speak any English at all. The second patient that he told me about was a native lady, an Alaska native, and she could write English, but she couldn't speak it. So every time her appointment came around, she came in with a notepad of her new concerns, what meds she needed refilled, and everything. She would write out a whole list of what was going on, and I guess she spoke very broken English, but was very embarrassed because it wasn't the English that the doctor spoke to her, so she felt embarrassed. So she brought in notes, and then he would talk to her, and she would write a note for him. So I thought that was kind of interesting how they went about that situation. At clinic number 3, he also told me that it was more common for the patients to bring an interpreter. He said that they know the office and they know that there's no one there that can help them through their appointment, so they would bring somebody to help them through their appointment. I asked him about the new patients. I mean, how do they schedule? How do they come? How do they have their appointment? How do they talk to them? It's kind of... He said that at the time of scheduling the appointment, the patient knows whether or not there's someone in the office that can speak to them and help them through their appointment, or if they're going to need an interpreter. And he also said that they have a program where they can call an interpreter to come to the office to meet the patient for their appointment. Unfortunately, I didn't get to speak to any patients regarding their care, if they thought that they could be treated better, if they knew English, or if the doctor knew their language. I know Alaskan Native languages, there's many of them, and it'd be hard to learn them all, but if you knew some words, I think that you could help your patients a lot better. When I was younger, I did go to Mexico, and I had an ear infection, had to go to a Mexican doctor. He did not speak any English. I had no idea what was going on. I just kind of shook my head yes and no, and I didn't really know what was going on, but he gave me antibiotics and sent me on my way. So I don't really know if things went well or went bad. So I do feel for the patients that don't speak English from different countries or different Alaska villages. I kind of feel like I wouldn't be getting the proper care if I were them. From the doctor's perspective, I asked him if he had any interest in learning the different languages that his patients speak to try and give them better care. He said that is something that he would possibly think about, but since there's interpreters and things like that they can call or the patients can bring with them, he thinks that was okay. So I know doctors are busy, and languages are hard, very hard to learn. So I feel for him, but I also feel more for the patients because I've been in their situation. I learned a lot from doing this project, especially I wanted to go into healthcare. I still want to go into healthcare. That's kind of my plan and my route in my schooling right now. So I think it was kind of important to learn about the different languages. It definitely makes me want to take something like Spanish or an Alaska Native language so that I can better my patients, because I do plan on practicing in Alaska, and those were kind of the biggest one was Native languages and Spanish-speaking patients. I also wanted to give a thank you to Doctor Number 3 for helping me out with my project. Thank you!